We won a battle and then we lost a big one in the text. What was your plan to make healthcare more accessible, more affordable to all people?
July was so encouraging. There was this attempt to repeal the Affordable Care Act, and we, not politicians, folks in this room and beyond the walls of this room, defeated that effort by one vote in the United States Senate, created the public pressure to form the political will to get the Senate to do the right thing. But then we had this loss this last month where along party line votes, not a single Democrat being able to contribute an idea or an improvement or even a vote along party lines, they passed a tax bill that undermines significantly the Affordable Care Act. So what's our response to that? Number one, in Texas, we absolutely have to expand Medicaid so that more people can afford to see a doctor or a provider. We have to review, let's hear it. And lest anyone be under the illusion that we are an overly generous state, there are 28 million of us. Only a little more than 4 million are enrolled in Medicaid today. The vast majority, 3.5 million of them, are children, kiddos, little people, the most vulnerable among us, who in some cases depend on their very lives for the ability to see that provider. Related to that is CHIP, Children's Health Insurance Program. If you make too much to enroll in Medicaid, but not enough to afford insurance, and your child still needs to see a doctor, you can use CHIP. If CHIP exists, it is supposed to run out of authorization and funding on the 19th of this month. That has to be a priority. And then we need to take some bigger steps, some difficult steps, and we've got to do it on a bipartisan basis, like introducing Medicare on the public exchanges so that there is real competition and choice in every one of our 254 counties in Texas. That drives down the cost of healthcare and premiums, improves access and availability across our networks, and ultimately we need to get to true universal healthcare. And I'll tell you what, it is. My wife accuses me of being a bleeding heart. She says, Beto, you're always talking about what we need to do for people, and you're right, but talk about why that's good for everyone else. And it's true. When that person who was denied the ability to see a doctor can see one, we diminish her suffering, we improve her outcomes. The potential that she's going to realize is unlimited, and that's good for her and her family. But it's terrific for the rest of the state because we don't pay for her care at the emergency room, at the point of crisis when it's the most expensive and will do the least good, versus taking care of it preventively, proactively, and consistently across time. One example, one person in Bexar County went to the emergency room there 40 times because they didn't have insurance, untreated schizophrenia, cost $90,000 for just that 1 month, which they didn't have the money to pay for. That cost was borne by everyone else. Imagine that happening 12 months every year across thousands of Texans throughout this state. There's a much more effective, efficient, better way to do this.